Without a doubt, the COVID-19 pandemic has impacted the global economy on a very large scale, resulting in innumerable direct and indirect issues of health, social, emotional, and educational effects as families and their children face homelessness, job loss, hunger, depression, and anxiety. The duration of the pandemic is uncertain, and the well being of families is at risk. Therefore, it is unquestionably important that they are not further disadvantaged. Hence, we advocate for interagency relationships between sectors such as health services, the housing sector, welfare departments, and the Ministry of Education to cushion the effects of this pandemic. It has been grounded in Brunner's historic bioecological hypothesis that children's growth is affected by overlapping and joint levels of impact, expanding from each child's factors through the family and other significant people, such as peers, to the more extensive society. Also, it has been acknowledged that the most deprived kids in families confronting various dangers are the most commonly to have poor end results. Various and diverse possibilities are to be expected to be noticeable at several levels of influence at the same time. For example, individual, family, and environmental living situations. And to intervene efficiently, services are required to be provided at every one of the required levels, which will be scaled most successfully by interagency working. It is evident that it takes the collaborative effort of multiple agencies, ministries, and organizations to manage the effects of COVID-19 and positively influence change towards the advancement of vulnerable families in the Caribbean. Our fantastic advocacy team has ascended to this challenge, utilizing their ability and experience to support families by staying up to date about all issues to improve programs and services for families. We understand and we are taking every step necessary to ensure families are provided with the necessary service and significant means of approach to assistance. Care Connection Advocacy will continue to reflect on what has worked and what unfortunately did not work in order to influence policy and practice towards greater improvement as it pertains to reducing the many issues plaguing families across the Caribbean. We are in this together and we will get through this together, united with sturdy foundations for interagency relationship amongst the health, housing, welfare, and Ministry of Education sector.